What is coronavirus? Coronaviruses are a large family of viruses with 4 human viruses causing mild colds in all age groups. The virus looks like it has a crown, hence the name. The family also includes viruses from animals that can infect humans in a process called zoonosis. This form of infection has caused severe pneumonia and death, such as the new virus coronavirus, COVID-19. Previously, we have seen similar disease with the severe acute respiratory virus, SARS, and Middle East respiratory syndrome coronavirus virus, SARS, viruses. COVID-19 began in the city of Wuhan in the Hubei region of China, but there is currently local spread in other countries including South Korea, Iran and Italy. Isolated cases who have been infected abroad have been imported to other countries including Norway and other Nordic countries. How does coronavirus infect? The original new coronavirus infection probably came from an animal and infected humans. Now it infects people through sneezing and coughing, but also through contact with virus-contaminated surfaces. What are the symptoms? Common symptoms are respiratory symptoms with fever, fatigue, cough and very rapid or labored breathing. Severe symptoms may include pneumonia, severe acute respiratory syndrome, renal failure and death. What should you be aware of if you are afraid of getting infected? It is an acute infection with common cold symptoms. If you have been in contact with someone who may be infected, you should contact the healthcare system and ask for advice if you suspect infection and especially if you have rapid or labored breathing. What precautions should you take if you are traveling or going to one of the countries where the virus has been detected? Avoid close contact with sick people with fever and respiratory symptoms. Wash your hands frequently with soap and water or alcohol-based hand infection. Good cough and nose hygiene is also important, by covering your mouth and nose with paper towels or the elbow. Discard the handkerchief and wash your hands afterwards. Avoid close contact with animals and markets that sell animals and fresh produce. It is important food is sufficiently cooked or fried and follow good food hygiene. Who dies of the new coronavirus? Approximately 14% of the infections are serious, and about 5% of cases are critical. Of the cases in Hubei, approximately 2.3% have died of pneumonia, but half of these are patients who have had critical illness and often are older patients with underlying disease. The mortality rates are lower in the rest of the world at 0.3%. Many patients who experience severe disease have diabetes, pulmonary disease or other chronic diseases, and in Hubei region approximately 4% of cases were in front-line healthcare workers. Should you avoid traveling to the countries where the infection has been detected? There are no specific medicines or vaccines against the new coronavirus. Therefore, one should consider postponing travel to infected regions. As the situation is changing rapidly, it is best to keep up to date with the World Health Organization (WHO) travel advice and the Norwegian Directorate of Immigration, Foreign Affairs travel advice. What is the risk of the new coronavirus causing a pandemic? Neither SARS nor MERS developed into pandemics, but we have seen the situation change rapidly with COVID-19 and the WHO has confirmed it as Pandemic 11 March. It has now status as a virus that spreads easily from person to person, across all regions around the world. Protecting yourself and others. You can protect yourself from coronaviruses by following basic wellness practices. Keeping your home and surfaces clean using the correct disinfectants is crucial in preventing its spread. The novel coronavirus may be able to live on surfaces, namely metal, glass or plastic, for up to 9 days, if it resembles some of its other human coronavirus-causing cousins, that is. There are a few general rules to follow when it comes to washing your hands thoroughly, including for how long you should keep them under running water. If soap and water aren't available, hand sanitizer is the next best option, namely if it contains at least 60% alcohol, the CDC says. Keeping your hands off your face is easier said than done. One study found that people touch their faces some 23 times an hour on average. Surgeon General Jerome Adams said, "There is no evidence right now that the coronavirus can be spread through mail." As the coronavirus risk grows globally, being smart about planning travel will help you stay safe. The CDC recommends washing your hands with soap and water for at least 20 seconds. Avoid touching your eyes, nose and mouth with dirty hands. Avoid close contact with sick people. For those who are sick, staying home until you are well. Avoiding close contact with others. Cover your nose and mouth when sneezing or coughing. Keep objects and surfaces in your home or workspace clean and disinfected. Do surgical masks protect against coronavirus? The masks, which cover the nose and mouth, are often made from a flimsy material and aren't fitted to the face. In other words, spaces and gaps can form around the cheeks and edges of the mouth, making it easy for air to move in and out. A more protective mask, known as an N95 respirator, may be more effective, said Schaffner. But, he noted, a non-medical professional using this mask is likely not using it correctly, doing little to prevent the spread of illness or inhaling a disease. As for more preventative measures, Schaffner recommends abundant hand washing. Is the novel coronavirus here to stay? COVID-19 is a respiratory virus, and if it behaves like other respiratory viruses, including influenza, the flu, we might anticipate that it will abate as the weather gets warmer, he said. But, he added, it may become part of our usual cold and flu season. The virus is new in humans, meaning medical experts at this time cannot predict the long-term impact on the global community, Schaffner said. We are now in the containment phase and are working to restrict the virus spread in the US and internationally. So the virus will traverse the world, probably infecting between 40 and 70% of the global population during its first wave. This might occur over a painful 6 to 12 months, or it might be spread over a more manageable several years. Either way, once the first wave is done, the virus is probably here to stay.